Good day, viewers and listeners, and welcome to the COVID-19 update for today, Tuesday, November 9, 2021. I am Godfrey Brooms, and soon we will be speaking with the Minister of Health, Dr. Frank Anthony, who will be telling us about the COVID-19 hotspots across the country and also the vaccination program for pregnant women. Even though we've seen a drop in the number of cases in the Region 4, there are still some hotspots in the region. Yesterday, you gave us a breakdown of the active cases per region. Can you tell us today where are some of the hotspots in Region 4 and the outer regions?
The places that we have noticed in Region 3 where there are lots of cases would be places like Tushin. We have 59 cases right now that is active in Tushin. We have Parfaith Harmony where we have about 52 active cases. Port Royal with 51 cases. We have Crane, 50 cases. Parika, there are about 49 cases. Cornida Ida, 42 cases. Around the Vreden Hoop area, there are about 41 cases. Zeeland, 41 cases. Hague, we have 38 cases. Lenora, 34 cases. Westminster, we have 32 cases. Iflot, 29. Anna Katrina, 28. Canal number 2, we have 28 cases. Lagrange, 26 cases. Good Fortune, 25 cases. Stewartville, about 25 cases. Sisters Village, 24 cases.
The COVID hotspots in Region 4 are Diamond, Grove, Kitty, Sophia, Campbellville, and the Cummings Lodge. The COVID hotspots in Region 10 are Wismar, Mackenzie, and Amelia's Ward.
We are on schedule. We'll receive some in January and thereafter. But in addition to these scheduled rounds that COVAX would put out, between these rounds, countries like in the richer countries would also donate vaccines through the COVAX mechanism. And when these vaccines are donated, they generally have a shorter life expiry date. So COVAX would reach out to all the countries and ask whether or not we have some immediate need for vaccines, and if we indicated yes, they would send some of the vaccines to us. We have benefited from that in the past, and right now there's a call that is out, and we'll have to assess whether or not we need to ask them for some additional vaccine. Right now, we have enough stock of vaccines. We are waiting the final documentation from the US CDC. We know that they had these discussions both at the FDA level and then the CDC level. And so we are waiting on some, they normally would issue some reports. We want to see those reports before we started that process. We have seen some of the women coming forward and getting vaccinated. We have also been working with a lot of the private hospitals to ensure that women who goes to these private institutions can access the vaccine. A lot of the obstetricians have come on board, and they are talking to their patients pertaining to getting the vaccine. Pregnancy would depress the immune system. So if you compare a pregnant and a non-pregnant person, the pregnant person, we are seeing that if they get COVID, that more than likely they'll get a more severe form of COVID. And that is why, to prevent that from happening, if they are vaccinated, then they would not get that severe form of COVID. And therefore, it is important for them to get vaccinated. Now, vaccination can occur in any one of the 3 trimesters, whether it's the first, second, or third, it doesn't matter, you can get vaccinated. And also, if you do get COVID, what we have noticed, the trend is, you get COVID and you get pneumonia associated with COVID, then that can lead to other complications in the pregnancy, which includes person giving birth earlier than they should normally give birth. So if it's 38 weeks, we have seen a pattern where people would give what is called preterm birth, maybe by 37, 36 weeks. There's no truth in that. I think some celebrity in the US made this comment and it went viral. But there's no scientific evidence to back that up. And so while that might have spread and people latched on to these sentiments, there isn't any scientific evidence, no medical evidence to back that up.
COVID vaccination numbers. Adults, 387,505, or 75.5% of the adult population, took the first dose of a COVID vaccine. 253,938, or 49.5%, took the second dose. Adolescents, 27,954, or 38.3%, took the first dose, while 19,028 persons, or 26.1% of them, took the second dose of the vaccine. And that's it for the COVID-19 update today. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy. Godfrey Brooms is saying goodbye for now.